All right. Well, back to the heat map here. There's been little change in the percentage of U.S. counties that are in the high transmission rate, but the case rate across the country has gone up. The 7-day moving average is up 37%. And this is predominantly, well, 99.9% the Delta variant. And I know there's a lot of talk about Omicron, and we'll get to that later in the presentation, but this is still part of the Delta wave. As far as hospitalizations in the country, those are going up as well, almost 15% across the country. Death rates started to go up as well, up 27.8%. We're also seeing vaccination rates going up across the country, but this is mostly driven by the booster doses. Just like we saw with the Delta surge, as the news coverage increased on that, that drove up vaccination rates, and now with the Omicron news seems to be driving up interest in vaccination rate right now. In the country, 60%, almost 61% of the total population is fully vaccinated, and as people get older, they tend to have a higher vaccination rate as well. Looking at booster doses, we have about 27% total that have gotten their booster doses. And as Omicron starts to make an appearance, that's going to be really important to get people boosted. With regards to Washington State, we continue to trend downward on this image. It looks like there's a little bit of a plateau. If you look at December 9, the rate's even a little bit lower. And I know the newsreels say that Washington State, has increased more than 30%. But looking at that a little more closely, looking at the 7-day case rate, you can see short-term changes much more easily. And from November 27, which is the nadir right here, the cases did go up, and they went up 39%. And I think that's where the newsreel came from. But from December 4, from this peak to now December 9, that's the most recent data we have, cases decreased 63%. So if you look at the nadir to where we are now, cases have actually decreased 14% in Washington State. Hospitalizations plateaued a little bit. Washington State deaths also plateaued a little bit. Looking at Walla Walla, this is a 7-day case rate curve. We are below the state average. And just like the Washington State data, there was an increase between November 26th and December 3rd. It increased 45%, but then there was a 57% decrease after that. So from this little nadir to where we are today, there's been an 8% decrease in the case rate. And we see these little tiny peaks and troughs as we go down, but things are continue to trend downward. This is the 14-day case rate, and out of 39 counties, we rank 29th for the 14-day case rate. And I don't know if you remember the days when we were in the top 3. So it's nice to see that our case rate is well below the state average, and our ranking is much more favorable. Looking at Walla Walla hospitalizations, because we have small numbers, this chart can be pretty jig-jaggy, but we've had a daily census somewhere between 2 and 10 cases per day, and the majority of those hospitalizations are in unvaccinated individuals. Looking at vaccinations in Washington State, I mean, there are different metrics you can look at, but it's good to see that I can get Walla Walla on a single screen on the DOH website looking at initiation of vaccination. We rank 12 out of 39 counties. If you look at total population fully vaccinated, we're at 15 out of 39 counties. So we're continuing to make incremental progress. We need about 625 people to get vaccinated in order to increase a percentage point. And I was reflecting on a newsreel that I saw that the governor of Colorado, I believe, has pretty much thrown in the towel trying to reach people for vaccines. And I can tell you that I'm not going to throw in the towel. I think we can continue to make some small incremental progress. and I think our community deserves that. So we're going to keep working hard for all of you. Looking at our vaccine efforts in Walla Walla, last week we had 9 clinics. We delivered over 1,100 vaccines. Almost 100 of those were first doses. It'd be nice to see that number a little bit higher, but we're having people that are completing their series, and the majority of our business is booster doses. This is a CDC graph that just reinforces the fact that most of the deaths in the United States are unvaccinated, and these are for the most part preventable. So just encouraging people to get vaccinated. I know there's been a lot of talk about the Omicron variant, and it has now been detected in 30 states. But you know, last week I think it was 17 states. But I think we can assume that it's pretty much basically almost in every state. There have been some studies on trying to calculate what the effect of Omicron is going to be, and it does seem to have a relatively high reproductive number. If that's the case, we should see a doubling of cases every 3 to 4 days, and then it would become the dominant strain. In South Africa, it quickly overtook the Delta strain, but our demographics are different. Even though they do have a younger or potentially healthier population, we also have more vaccines, and so potentially more immunity in the United States, and especially Washington State. So it's possible that it won't behave quite the way it did in South Africa. There are also studies emerging about the benefit of prior infection, and they were doing studies with neutralizing antibodies, which is not the complete immunological picture that is involved in the person's immunity, but it appears that prior infection with the previous dominant strains is not really that much protective for Omicron. However, in those people that did have a prior infection and were vaccinated, or people that were fully vaccinated and got a booster, it was much more protective. There's also more and more conversation about the severity of the illness, and it really is too early to tell. Although looking at South African data, hospitalization rate and the case rate with prior waves in South Africa, they pretty much paralleled each other. And there is somewhat of a blunted hospitalization rate compared to their case rate. But there's still a lot of unknown, but in general, we know what works for Omicron, and it's still back to the basics. Getting vaccinated and then getting boosted has a huge benefit, and then the other usual mitigation measures.